Our group had the opportunity to present on emotional behavior disorder. In this presentation, you will gain a better understanding of emotional behavior disorder, its characteristics, and its etiology. We will also discuss supports needed to work with students with this exceptionality, curriculum that is used with these students, and evidence-based practices that we can use in special education to make sure these students are successful now and later on in life. What is an emotional behavior disorder? An emotional behavior disorder is characterized as an umbrella term used to describe multiple disorders, including anxiety, depression, obsessive-compulsive disorder, and psychotic disorder. Etiology of the exceptionality. Our text noted 3 main causes of an emotional behavior disorder. These included biological causes, environmental causes, including school factors and family factors. When looking at the biological causes, it was noted that genetics and neurological reasons played into why a student may have an emotional behavior disorder. Next were the environmental considerations. When it comes to school factors, research indicated that teachers do not always adequately use evidence-based practices and sometimes have negative attitudes when working with students that show multiple internalizing or externalizing behaviors, and those that contributed to students having an emotional behavior disorder. Lastly, family factors. Socioeconomic status and family history played a large role in determining the cause of an emotional behavior disorder. It was noted that a history of depression in the family and a household of violence and hostility dramatically increased the likelihood of a student showing internalizing and externalizing behaviors. Next, we'll discuss the characteristics of students with an emotional behavior disorder. The characteristics were described as emotional, behavioral, and academic and cognitive. When looking at the emotional characteristics, it was broken into 2 subcategories: anxiety disorder and mood disorder. Anxiety disorder is one of the most common childhood disorders, characterized by excessive fear, worry, and uneasiness. A mood disorder involves an extreme deviation in mood, either in a depressed or elevated direction, and sometimes in both directions at different times. Next, behavioral characteristics. Students with an emotional behavior disorder tend to show either extreme externalizing or internalizing behaviors. Externalizing behaviors are disruptive and annoying behaviors that are directed outwardly, such as aggression, acting out, and noncompliance. Internalizing behaviors included withdrawal, depression, anxiety, and fearfulness. It was noted that girls tend to show more internalizing behaviors, while boys show more externalizing. It was also noted that sometimes girls are overlooked for having an emotional behavior disorder because they internalize so much, and it's not as noticeable as the students who externalize and act outwardly. The last characteristic of a student with an emotional behavior disorder was listed as cognitive and academic characteristics. Students with an emotional behavior disorder may be either gifted or have an intellectual disability. It was noted that only 38% of students with an emotional behavior disorder graduate with a regular diploma compared to 55% of all students with disabilities. It was also noted that 22% of elementary students with an emotional behavior disorder were retained in their grade. Students with an emotional behavior disorder exhibit characteristics that affect them as a whole, socially, emotionally, academically, and cognitively. And while some students may show some of these characteristics, they may not show all of them. Some students may be adequately performing in their classroom while only showing emotional and behavioral parts of it. Next, we're going to look at the placement of students with an emotional behavior disorder. Students with an emotional behavior disorder are at a higher risk of not being included in their general education classroom and being segregated into a separate specialized classroom for students with an emotional behavior disorder. When looking at the graph below, it describes the placement of students with an EBD. 43% of students participate in their regular classroom 80 to 100% of the time. 18% of students participated in their regular classroom 40 to 79% of the time. 21% of students participated in their classroom 0 to 39% of the time, and 18% of these students were placed in a completely separate setting. Instructional strategies and evidence-based practices. Instructional strategies and evidence-based practices can follow an RTI, or response to intervention model. One being most of our students, or 80% of our students, will participate and be motivated with the rest of the grade level. 15% may need a little more extra practice or more individualized strategies. And our Tier 3 students, which may be most of our students with an emotional behavior disorder, that need very structured, intense, individualized strategies to help them be successful. Some of the supports needed to help our students with this exceptionality include wraparound services, class-wide peer tutoring, self-management using technology, and self-monitoring practices, providing our students opportunities to learn based on their interest, using these school-wide positive behavior supports, and consulting with our mental health team and the student's family. Next, we'll look at the social skills and social skills curriculum that we can use in a school to help these students. First, a behavior and emotional rating scale taken from 3 perspectives, the child, the teacher, and the parent, can really help assess strengths and interpersonal capacity for these students and help us get a better understanding of their school functioning and effective ability so we can move forward with planning how to support them the best we can. Next, conflict resolution skills, so teaching these students how to negotiate, how to compromise, how to problem solve, and how to make decisions. When looking at a social skills curriculum, schools may use something like Second Step, which is a program that can be used in our special education setting, in a social work setting, or in a general education setting. Second Step is a program that teaches social emotional learning, and the lessons provide skills for situations that occur frequently, including bullying and peer conflicts. Next, we'll look at the cultural factors and family dynamics. There's an overrepresentation of culturally different learners in special education classrooms, including those students with behavior disorders. This can sometimes be attributed to the fact that teachers are not culturally competent and do not always know how to adapt their style of learning for these students. A student's culture plays a large role in their learning style, and their cultural and linguistic differences are sometimes misclassified as having a disability. Next, we'll look at family dynamics. Children who experience socioeconomic challenges are 2 to 3 times more likely to develop problems associated with an emotional behavior disorder. It was noted that about twice as many elementary and middle school students with an emotional behavior disorder live in poverty compared to students in the general education population. Parent rights. When we advocate for our students, we also need to make sure that we're advocating for their parents as well. Parents have the right to be active members of the IEP team and be fully aware of the placement and services their child is receiving. When working with parents, there are a lot of strategies we can use to increase participation and partnership, including communication, being an advocate for them, reaching out, and really building a relationship with them, which includes getting to know them, making phone calls, emails, and sharing successes with them. Culturally responsive practices. As we discussed before, we have an overrepresentation of culturally diverse students in special education. It's increasingly important that we become very familiar with our students' culture, that we're aware of any biases we may have, that we're modifying our curriculum to include their culture. We have high expectations for all of our students. It's also important that we build relationships with these families and accept these cultural differences and make sure our classroom is a community. By bridging the gap of language barriers and having a translator to help with communication needs, we're better serving the needs of our students and their parents. In conclusion, there are many factors that go into an emotional behavior disorder. Students with an emotional behavior disorder typically have a normal intelligence range. But because of the behaviors these students exhibit, they are often excluded from the general education classroom. As educators, we are responsible for advocating for these students and providing the supports needed in order for them to be successful now and in adulthood.